Hey, what's up everybody? Dr. LeGrand here to talk about vitamin D and ADHD, how it actually is important for ADHD. And I thought I'd talk about this here outside since it's nice out here in the Northwest. Usually it's rainy, but in the summertime it's actually pretty nice. So let's talk about vitamin D and how it's important for ADHD. Hey everybody, Dr. LeGrand here. Welcome back my Optimal Mind performers as well as my Optimal Mind leaders. If you are new here, I am Dr. LeGrand. I grew up with ADHD and dyslexia. If you have not subscribed already to our channel, go ahead and hit the subscribe button because we talk about everything about ADHD here, ADHD health, entrepreneurship, as well as other personal development skills. So go ahead and hit that subscribe button, as well as if you like this video, give us a thumbs up. And then of course, hit the bell notification so you miss out on any other future videos. So let's talk about vitamin D and how it does help affect with ADHD. First, let's talk about what really vitamin D is and what it does. Now, vitamin D is very important for our bodies, a nutrient that our brain does actually use. It does help with our neurotransmitters as well. We've talked about this a lot, about different types of nutrients that do help with neurotransmitters. So specifically, it can help with dopamine, serotonin, as well as acetylcholine, which does help for our factor for focus and attention. Now, the thing that's interesting about looking at certain studies that have actually been shown with people, especially with kids with ADHD, they tend to be more deficient in ADHD that they found in research. And so by implementing and looking at different things that could be specifically out of balance when it comes to ADHD. So that's the first thing, is understanding that especially children with ADHD can have a deficiency. So the first thing you should first check is, of course, if you actually have a deficiency before needing to implement vitamin D into your treatment plan. So the other thing is also looking at the aspect that vitamin D does help with the immune system, it does help with energy, and what they have found overall for vitamin D is because there tends to be a deficiency in ADHD, they also have found a deficiency in a lot of different mental health issues, such as anxiety, depression. That's where here in the Northwest, especially out here in Washington, I do deal a lot with people with ADHD, depression, anxiety. Might be a reason because we don't have as much sun as everybody else around here, but so that might be a contributing factor. But because vitamin D has been shown to help with neurotransmitters, and I've stressed this so much, is you need to focus on what helps with neurotransmitters when it comes to ADHD or any kind of mental health, because that is what is the problem, is the deficiency. When we add medications, it helps increase that, but it doesn't help make more neurotransmitters. It just blocks the reuptake of neurotransmitters, so therefore the brain will produce more, but doesn't necessarily make neurotransmitters. So once you take that medication away, guess what? Then you start having run into issues. That's why people can't just go cold turkey on medications. But if you start implementing nutrients that can help with the process of neurotransmitters, can help with also building it, then we can actually start getting to a point where you can start getting better results versus just trying to switch out different medications all the time, but trying to implement good nutrient practices. And vitamin D might be one. So what I suggest is first check to see if you have a vitamin D deficiency and check it on a regular basis. So if you are someone that has a vitamin D deficiency on a consistent basis, definitely start implementing vitamin D. Usually what I suggest people who have a low of vitamin D to start off, depending on how low you are, but usually you could go to 10,000 IUs a day. Do that for about a couple months, but of course always check with your doctor first about supplementing anything. But usually about 10,000 IUs a day to kind of get your levels back up where it needs to be. And then of course, maintenance dose is what I would say is about 5,000 IUs. But you don't necessarily need to do that in the summertime because the sun is where you get a lot of your vitamin D. But of course, during the winter months when we don't have much as daylight hours, then you would use a maintenance dose of something like 5,000 IUs, okay? So those are the things that I'd recommend. If you want any further information as far as how to get supplements, nutrients, and also different labs that you should be running for your ADHD, then go ahead and download my free guide that's in the description below. And until next time, this is Dr. LeGrand signing out, and I will see you guys next time. And remember, you have an optimal mind. See you guys later. Thanks. Bye.